Hi, I'm here at the Alzheimer's Association International Conference, and I'm presenting my research, some of the first work to look at subjective cognitive decline or self-reported memory problems in LGBTQ older adults. What we found with this work that's really unique is that we found that older adults who identified as LGBTQ were more likely to report having problems with their memory, about 1 in 7, which was higher than their non-LGBTQ peers, where it was around 1 in 10. We also found that they had more problems doing household tasks and had to give up more social activities compared to their peers. So I'm Jason Flatt. I'm an assistant professor. I'm at the University of California, San Francisco, and I'm in the Institute for Health and Aging at the School of Nursing. Some of my work also that I'm presenting here today, and which is behind me, I'm looking at how is mental health seen as a risk factor for LGB older adults. These are people that were age 60 and older, and what we found was they had a higher rate of depression, anxiety, and also PTSD compared to non-LGB older adults. This data comes from Kaiser Permanente in Northern California, and it's really representative of our region. It includes San Francisco, Sacramento, and some of the Central Valley. So we have over 4,000 LGB older adults in our study, and what we found is if they had a diagnosis of depression, they were almost 3 times more likely to be diagnosed with dementia compared to other LGB people who did not have depression. We also saw similar trends with anxiety, where people who had a diagnosis of anxiety were about 90% more likely to have a diagnosis of dementia compared to those without anxiety. So this is unique in that we're using medical record data, and we have this data from 1996 through 2015. And some of what we're hoping this data can help with is really to advocate for improved screening, also education of healthcare providers, how to provide care to LGBTQ older people. Right now we know that many forms and also the care that's provided is not always inclusive. And LGBTQ people have had a history of being discriminated against in medical settings. So we're really hoping this information can be used to advocate for more research and also to find a cure for Alzheimer's.